Do you have any numbness, tingling, or weakness at your shoulder, arm, or hand? Do you find the symptoms getting worse with your arm in the overhead position? Are you worried that you may not be able to continue playing the sports you love, such as cricket or tennis? Have you had many treatments before, but the condition is not getting better, and you're worried that you may need to get surgery? If the answer is yes for the above questions, this is the video for you. Hello everyone, I'm Zoe from Pain-Free Physiotherapy and Allied Health. Today I'm going to talk about thoracic outlet syndrome. Thoracic outlet is the space between your collarbone and rib one. From medical perspective, thoracic outlet syndrome occurs when the blood vessels or nerves in the thoracic outlet are compressed. Common symptoms include pain at the neck, shoulder, and arm, numbness and weakness in the arm and hand. You are more likely to have thoracic outlet syndrome if you like doing activities that involve repetitive shoulder or arm movement, such as playing tennis, volleyball, or swimming. Having a job that requires use of arm in elevation, such as a barber. Having poor sustained posture. Or having an extra rib above the first rib. In order to make a diagnosis of thoracic outlet syndrome, your doctor or physiotherapist may perform special tests on you. For example, elevated arm stress or Rule's test, essence test, Wright's test. Your doctor may get you to do imaging such as ultrasound or MRI. In many of the cases, the results will show that your nerve, artery, or vein is compressed. The doctor may then prescribe pain or anti-inflammatory drugs to help relieving your symptoms. In some cases, especially if you have the cervical rib, they may suggest you to surgically remove the extra rib. However, the success rate of the surgery is not really high. Then many patients may still have some symptoms even after the surgery. In fact, most of the time, the cause may not be compression of nerve or blood vessels. Some other structures, such as tight muscles or joints, may be mimicking the nerve or blood vessels. In pain-free physiotherapy, we use a holistic approach to assess your body as a whole from performing a head-to-toe examination. We identified all the possible contributing factors of your symptoms and target our treatment to the real causes of your problem, instead of just focusing on the local areas. In some cases, we find that the real causes are inside the thoracic outlet area, such as scaling.
It's muscle energy technique. If the patient has got an elevated first rib, okay, for example, if it's elevated on the right side, okay, it's usually the scalene on that side is tight, so it pulls the rib one into elevation. So what we need to do is a muscle energy technique to lengthen that scalene and also restore, actively mobilize the rib one, okay, to restore that rib one position. So this is what you do. You side bend the patient's head until you feel the restriction coming on, okay? And then this hand palpate the rib one. So you side bend until you feel resistance coming up from where your rib one hand is. And then you ask the patient to gently push the head to the right and then breathe in and relax the head and breathe out at the same time. Okay, so push to the right and breathe in. Relax and breathe out. Okay, as you relax, as you push the head into a little bit more, okay, side bending. Okay, push to the right again, breathe in. Relax and breathe out. Okay, so this hand, the right hand, keeps pressing the rib point down. Okay, so you do about 3 times, and then you can reassess the range.
In some instances, we find the cause can be outside of the thoracic outlet, such as the levator scapulae, which is mimicking the symptoms of the nerve and blood vessels. For many of our clients with thoracic outlet syndrome, the levator scapulae muscle can be tight. This causes the shoulder to appear very slopey, and all the structures in the area become very tense.
You get a white tape I can fix. I'm going to go from the inferior angle of the scapula to the superior angle of the scapula. Make sure you cover, the tape is long enough to cover those 2 angles. Okay, so you just lay it on, and then you get a piece of brown tape, but a little bit shorter than the white tape. Okay. Start from the inferior angle, and then you elevate the patient's shoulder. Okay, so create wrinkles. Okay. That will create a skin traction, and then elevate the shoulder. The shoulder becomes a bit higher than normal, and that will reduce the tension on this area and elevate the shoulder. So very effective treatment if people have dropped shoulder.
If you have any further questions, please contact our clinic or make an appointment. We look forward to seeing you pain-free.